Seniors, your CAC score heart scan explained in 3D. Has your doctor mentioned getting a heart scan for something called a calcium score? Maybe you've already had one and gotten a number back, like 0, 100, or even over 400, and you're left wondering, okay, so what does that actually mean? For far too many people, the very first sign of heart disease is a sudden major cardiac event. But what if you could see the warning signs years or even decades before that happens? Well, today, we're going to take a journey inside your heart arteries with a state-of-the-art 3D animation. We'll show you exactly what these calcium scores look like and what they really mean for your health. Most importantly, we'll clear up the confusion about your results, talk about the proactive steps you and your doctor can take, and give you the knowledge to take control of your heart health. This isn't about creating fear, it's about giving you information so you can take action. The 3D journey. What is coronary calcium? Let's start with a healthy coronary artery. Picture a perfectly smooth, flexible pipe, wide open, letting blood flow easily to your heart muscle. That's the ideal. But for many of us, especially as we get older, the story inside these arteries starts to change. Over time, things like cholesterol, high blood pressure, and inflammation can cause a waxy substance called plaque to build up in the walls of our arteries. This whole process is called atherosclerosis. In its early days, this plaque is soft and unstable. Think of it like a soft paste building up inside the pipe. This soft plaque is not what a calcium scan sees. However, as atherosclerosis goes on, the body tries to stabilize these plaque areas. It does this by depositing calcium into the plaque, which hardens it over time. This hardened or calcified plaque is like a scar inside the artery wall. It's this calcium, this hard evidence of plaque that's been there for a while, that a coronary artery calcium, or CAC scan, is built to find. The scan uses a special X-ray called a CT scan to take detailed pictures of your heart, and any calcium deposits light up as bright white spots. It's a powerful tool because it's not just guessing at your risk, it's directly measuring the presence of underlying coronary artery disease. So here's the key thing to remember. The calcium itself isn't the main problem. The calcium is a marker, a visible sign of the total amount of plaque that has been building up in your arteries over your lifetime. Visualizing the scores in 3D. Now, let's connect that visual to the numbers you get on your report. Your result is called an Agatston score, and it reflects the total amount and density of the calcified plaque the scan finds. Let's go back to our 3D animation. A score of 0. This is the best possible result you can get. Visually, it means the scan saw a clean artery with no detectable calcified plaque. A 0 score is incredibly reassuring. It means you have a very low risk of having a heart attack in the next 5 to 10 years, even if you have other risk factors. It's not a complete guarantee of 0 risk, but it's the best predictor we have for a healthy outlook. Now, let's look at a score in the 100 to a 1 to 100 range. On our animation, you'd start to see small, scattered white specks. This shows there's definite evidence of coronary artery disease, but it's in the early stages. This isn't a reason to panic, but it is a clear signal that it's time to get serious about prevention with your doctor. What if your score is between 101 and 400? This is considered moderate plaque buildup. Visually, our 3D artery now shows more significant and numerous areas of calcification. These are no longer just tiny specks, but noticeable deposits. A score in this range is linked to a relatively high risk of a heart attack or other heart issues over the next 3 to 5 years, and tells us that taking action is necessary. This is a serious wake-up call. Finally, a score above 400. This points to extensive and severe plaque. In our animation, the artery walls are heavily lined with calcium. This score means there's a very high risk of a heart attack, and it tells your doctor that a comprehensive and aggressive treatment plan is needed to protect you. Many reports also give you a percentile score. This compares your calcium level to other people of the same age and sex. If your percentile is 75% or higher, it means you have more calcium than 75% of your peers, which is also linked to a significantly higher risk.
Your questions answered. Seeing those numbers, especially a high one, can be scary, but knowledge is power. So let's tackle the most common questions people have after getting a CAC score. First, my score is high. Does this mean I'm about to have a heart attack? A high score is definitely a serious finding, but it is not a diagnosis of an imminent heart attack. Think of it as an early warning system. It's a measure of your future risk based on the total burden of hardened plaque. It tells you you have significant underlying disease, but it doesn't tell us if any of that plaque is severely narrowing an artery right now. The most important thing to know is that a high score is a powerful wake-up call that gives you and your doctor critical information to take proactive, life-saving steps. Second, this is the big one. Can I lower my score? This is a really important point. The direct answer is generally no. You can't lower the calcium score itself. That calcium is like a healed scar. It's there to stay. In fact, as plaque stabilizes with effective treatment, the score can sometimes go up a bit, which isn't necessarily a bad thing. So what's the goal? The goal isn't to lower the score, but to lower your risk. You do this by stabilizing the plaque you have and preventing new soft plaque from forming. The most dangerous plaques are the soft, unstable ones that can rupture and cause a sudden clot. The right treatments can harden and stabilize this soft plaque, making it much less likely to cause a heart attack. So while the number may not go down, your risk of a cardiac event certainly can. This leads to the most vital question. So what are the next steps? A high score empowers you and your cardiologist to create a personalized prevention plan. This always starts with aggressive lifestyle changes. That means adopting a heart-healthy diet. Think fruits, vegetables, whole grains, and lean proteins while cutting down on saturated fats. Regular physical activity, aiming for about 150 minutes of moderate exercise like brisk walking per week, is critical. And if you smoke, quitting is the single most impactful change you can make. Medically, a score above 0 often starts a conversation with your cardiologist about medications. For example, statins are cholesterol-lowering drugs that are extremely effective at stabilizing plaque and reducing inflammation in the arteries. Current guidelines often support considering statin therapy if any coronary calcium is present, and they're typically recommended for higher scores, like 100 or above, because any calcium is a clear sign of plaque buildup. Your doctor might also talk about medications to control blood pressure or low-dose aspirin therapy. In cases of very high scores, your cardiologist may suggest further testing, like a stress test, to see if any of these plaque buildups are actually limiting blood flow to your heart. The scan itself, what to expect. For anyone who has been told to get a scan but hasn't gone yet, let's quickly walk through the procedure because it's remarkably simple. The whole thing usually takes about 10 to 15 minutes. You'll lie on a table that slides into a large donut-shaped CT scanner. Your head stays outside the machine the entire time. A technician will put a few sticky electrode patches on your chest to monitor your heart rate, which helps the scanner time the images between heartbeats to get the clearest pictures. There are no needles and no contrast dye involved. You'll just be asked to hold your breath for a few seconds at a time while the machine captures the images. That's it. It's completely painless. The radiation exposure is very low, about the same as a screening mammogram. Afterwards, you can go right home and get back to your day. So let's bring it all together. We've seen how a healthy artery can develop plaque, how that plaque hardens and attracts calcium, and how a CAC scan detects this as a direct look at your underlying disease. A 0 score is wonderful news. A score above 0 is not a sentence, it's a starting point. It is one of the most powerful pieces of information you can get about your heart health, catching silent risk long before symptoms might ever appear. It helps take the guesswork out of your risk assessment and allows for truly personalized prevention. Remember, your calcium score is not your destiny. It is a tool that empowers you to change your destiny.
The most important step you can take, whether you're thinking about a scan or you just got your results, is to have an open conversation with your cardiologist. Discuss your score, your percentile, and all your risk factors to create a personal plan that's right for you. That is the key to turning this number into a longer, healthier life. For more clear, credible health information to help you stay proactive and informed, please consider subscribing to our channel. Thanks for joining us.